Good afternoon, everyone, and welcome back to another session of Premedical Presentations. My name is Mishanondo, part of Communications, Corporate Communications, and I am your host. Today's topic is the medical uses of enzymes. I would like to acknowledge the presence of our professorial team. We have Professor Njelesani, Professor Lambert, Professor Mwala, as well as Professor Mwansa, Professor Mulenga, Professor Emaus, Professor Viemba, Professor Kasolo, as well as Professor Kumar, Professor Gilani, Professor Emaus, and many others. Once again, the premise of these presentations is to not only capacity build within our students skills such as long case presentation, self-presentation, public speaking, as well as online etiquette. It also teaches, or rather this is a live session for those in attendance to equally get comfortable with webinar presentations, how to ask questions, how to interact, and use these virtual platforms. Once again, today's topic is the medical uses of enzymes. I would now like to invite our moderator to briefly introduce the topic and begin the presentation. Moderator, the floor is yours.
Good afternoon, everyone. Once more. Mr. Richard Perry, a lecturer in the Faculty of Premedicine, specialized in teaching biochemistry. And today I have brought some of my students to present to you one of the lessons that we covered in pre-medicine, which is enzymes. And specifically, they'll be looking at the medical uses of the enzymes. I have with me seven of some of our students. I will not introduce them. As they come to the podium to come and present, they will actually introduce themselves and indicate the part which they are going to present. So we will have the first presenter, and after that, at the end of the presentation, after all my seven colleagues have presented, we will ask the audience to ask us any questions. And also, we will also give you some questions to see if you are attentive in our answer. So we urge you to be attentive so that you can answer those simple questions at the end of our presentation. So I'll call upon the first presenter to come and start the presentation.
Good afternoon, everyone. Given this rare opportunity, standing before you here is Michaela Mokamwe, a student at Lusaka Premedical University in the year first year, second semester. So this topic today that we have for you is very interesting, enzymes, and I know that you might have heard about it before, but we would love to shed more light on its uses and what would have happened whether enzymes were not here. So first of all, I'd like to define what an enzyme is. So an enzyme is a biological molecule or biological catalyst that speeds up a chemical reaction. So it does this by lowering the activation energy. Technically, it's defined as the biological catalyst, as I have said. So today, we are going, as I have already defined what an enzyme is, and then we are going to look at how an enzyme helps to speed up a chemical reaction and how different is an enzyme to other catalysts. So enzymes are very important in our everyday lives, starting from the process of digestion, breathing, or even DNA replication. So scientists have estimated that DNA replication alone was going to take centuries for it to occur. But thanks to enzyme, it only takes a fraction of minutes. And if you give an example of putting a sweet in your mouth, it was going to take 3,000 years for you to take the sweetness. But because of enzymes, we're able to detect that within a few seconds. The body alone, the human body has over 75,000 enzymes, and each one of them has a specific task to perform. So before I go anywhere further, there's some terms that we're going to be using in our presentation today. But because we didn't want to make this rocket science for you, we would love to, or I would love to define some of the terms that are going to be very common in this presentation. I'll start a catalyst. A catalyst is a substance that speeds up a chemical reaction. It is neither consumed nor permanently altered as its consequence of getting involved in the chemical reaction. And then number two, we have the substrate. A substrate is a molecule or compound which is bound to the enzyme and then modified by the enzyme into its desired product. And then we have the active site, the part of the enzyme where the substrate binds. We have the activation energy, the minimum amount of energy that the substrate should possess for a reaction to occur. As I have already defined what an enzyme is, where it lowers this activation energy. And you have an inhibitor, which is a substance that slows down or stops the enzyme activity altogether. As you can see here, as I mentioned earlier about the activation energy, the diagram there shows how it's being lowered. And those red dots that you see there, that's how enzymes make a shortcut, because an activation energy is more like a hill. So the enzyme is going to make a shortcut for the process to occur. So how do enzymes help speed up reaction? So for every reaction needs to push to get started. I'll give an example of rolling a giant boulder off a hill. Like I gave an example earlier of a hill. So instead of going all around the hill, the enzyme will act as a shortcut. So instead of going all the way up to the top, it's just going to pave a way for the reaction to take place. And the enzyme makes sure that the activation energy is low as possible. And we have the substrate binds to the enzyme active site, forming an enzyme substrate complex. So I would like to give a well-known example of amylase, which is an enzyme that is found in saliva. The moment you put food in your mouth, you start chewing it, amylase will start to break down starch. And within a minimum of 30 seconds, with test buds, you'll be able to detect the sweetness. That's how strong enzyme. And the enzyme facilitates the reaction, converting the substrate into the product, which is then released. I guess this is self-explanatory. So the enzyme is responsible for facilitating the reaction, and then it is in charge of making the substrate into a product, let's say. And then the last point that I have, the enzyme remains unchanged and can catalyze another reaction. So after the enzyme substrate complex, the enzyme will still remain unchanged, will still remain an enzyme. So it will be able to continue or start all over the catalytic process. So enzymes are very important in our everyday lives, starting from the processes that we might have taken for granted, digestion of food, breathing, any kind of process that you may think about. It's because of enzymes. And without them, we don't know how slow life is going to be to the crop. So these biological catalysts are more fast and very precise, whether inside our bodies or even in industry. So enzymes will continue to shape the way that the world will work. So at this point, I will ask my colleague to come and take you up on another topic, or the third one.
Right. Thank you. Good afternoon, everyone. All protocol observed. My name is Chinya Nachonga, a first-year student, second semester at Apex Medical University. So I wish to ask every one of you to join with me as I take you through on the reasons why enzymes are referred to as biological catalysts, factors affecting enzymes, also the grouping or the classes of enzymes. So these enzymes are referred to as biological catalysts due to the reasons why is that they are natural catalysts made by living organisms. And unlike the inorganic catalysts, which tend to work under mild conditions such as pH, we have temperature and also under stress or pressure. So the functions of the binding, the enzymes tend to merge with the substrate at the site called active site, has already been defined for us. So by binding to the specific substrate, the enzyme tend to convert into the desired product. And what we see thereafter is that the substrate will bind to the enzyme at the active site, and the enzyme will undergo a conformational change, which will bring about the substrate into the correct orientation. And this will occur before the reaction occurs. So basically, the diagram that you are seeing there, or the picture that you are seeing there, just try to simplify the explanation above. So as you have seen, we have the substrate there with us on number one. And also, we have the enzyme with the active site there. So the two will match, or the substrate will bind onto the enzyme on the active site. And these two, they will form an enzyme complex, enzyme substrate complex. So then thereafter, as my sister already, or my colleague mentioned that, after formation of the product, the enzyme will go back to its normal reaction. So these enzymes, because they are made from the living organisms, they tend to also to be affected by several factors. And such factors, we have pH, also have temperature, and also the concentration of the substrate. So the higher the temperature, or the higher the pH, also affects the enzymes. So each and every enzyme, it has the specific optimal temperature that it works on effectively. So if any deviation to the optimal temperature, we see the enzymes being denatured or slowing down in their reaction. So these enzymes tend to work well with a helper, and these helpers are known as cofactors. So a cofactor is a substance that enhances the activity of an enzyme. So we do have examples of cofactors such as vitamins, and also have minerals such as zinc, copper, and magnesium. So due to these special enzymes, we see enzymes being classified. Enzymes are classified according to a specific substrate which they tend to work on or catalyze. So those enzymes that are involved in breaking the bonds using water, they are called hydrolase enzymes. And also the enzymes that are involved in the formation of simple bonds are called ligases. And also we have the enzymes that are involved in the oxidation reduction reaction, and those are called oxidoreductase enzymes. At this point in time, before I lose you, I would like to invite my other colleague to come and take it up from me. Other groups, I'll not mention them for the sake of time, and also to avoid also complicating the presentation, because we may end up losing you. Thank you.
Good afternoon, ladies and gentlemen. My name is Peter Smukarova. I'm a first-year second semester student at the Research Apex Medical University. Today, I'll be presenting on characteristics of enzymes, and I'll illustrate one of those characteristics. So, first characteristic of an enzyme is that all enzymes are protein in nature, and as such, they are affected by pH and temperature, just as my colleague is mentioning. The second characteristics of enzymes are that enzymes speed up reactions by not less than 1,000,000 times the original speed. For instance, my colleague mentioned you putting a sweet in your mouth. And if enzymes were not present, you would not be able to taste that sweet for about 3 million times. But since we have enzymes in our mouth, we can taste that sweet or whatever you put in your mouth in a matter of 30 seconds. A second example is that digesting food will take about 2 million years or more without enzymes. Because of enzymes, we can digest food in a matter of minutes. In addition, our immune system would take forever to protect us from diseases if we did not have enzymes. In short, all of us would be dead by now if we did not have enzymes. The third point, enzymes are all specific for the type of reaction they catalyze and the type of substrate they work on. This means a particular enzyme that works with a particular substrate cannot work with a different substrate other than the one it was intended to work with. There are more than 1 million reactions happening in our cell every second every second. For each reaction, there's a specific enzyme, as I just mentioned. Enzymes that work with proteins cannot work with carbohydrates. And this is actually a simplification of this detail. The fourth characteristic of enzymes are neither permanently altered nor are they consumed after a reaction. So this is an illustration of the characteristic I just mentioned. If you look at this first enzyme we have here, sorry for, it might look evil, but it's just an illustration, it's not evil. So this is an enzyme, and below we have a substrate. So the enzyme, or rather the substrate, will bind to the enzyme at the active site. And once it binds to the enzyme at this active site, we are going to have an enzyme substrate complex. Once this enzyme substrate complex is formed, a product will later on be formed from this substrate. And once the product is formed, the enzyme will detach from that product that has been formed, and it will be free to reconnect itself to a different substrate. As enzymes can be used over and over again by attaching to a substrate, creating a product, detaching from that substrate, and attaching to a new substrate. And this process is repeated continuously. Thank you. I believe I'm done for my presentation. I'll call my colleague finish up.
Good afternoon, ladies and gentlemen. It is my singular honor to present to you the two modules that are profounded in the enzymatic activities. And my name is Elias Yabocho. I am a pre-medical student, first year, second semester. Now, the most propounded models that are used in enzyme studies are to create an impression to us so that we may understand how they work, how the enzymes work so easily. I have the first model here. It is the lock and key model. It was propounded by a gentleman in 1874. It is called the lock and key model. It's like I have a key here and a lock. So in the lock and key, the active site of an enzyme is actually predetermined. The conformation is predetermined and is rigid. It can only suit and fit to one enzyme. Like you are seeing the enzyme here, take my key as the enzyme, and I have the lock. If I try to fit this key into the lock, it will not get in, as you can see. So that emphasizes the rigid specificity, which is governed by the predetermined conformation on the active site, the wall. But when you come with a specific substrate, it gets exactly into the active site. Then a reaction happens, the bottle product and the enzyme is free to be detached and go to engage the next substrate. Then the next and the more preferable one, the more used is the induced fit model. But if you take your hand to be a substrate. You feel warm, you want to feel warm, but it's cold. Your blood is supposed to be supplying heat, but it's not happening at the rate at which your body is comfortable. So you look for a glove, which you will take as an enzyme to quicken the warming process. So your hand is the substrate, and then the enzyme itself, the active site is in the inside of the glove. The shape of the glove itself is not predetermined. One, two, it's not rigid, like in the lock and fit, lock and key model. So one substrate, which is my hand, seeking warmth, will come and fit exactly into the site of the enzyme, right? So you discover that the active site of the enzyme will actually adjust to the shape of the substrate, number one. Number two, you will also realize that in this model, another enzyme, which is not specifically one, will come and fit in the end of my lecture here. You come and fit. This is another substrate which will fit in the same enzyme. This is the Koshner model, or we call it the induced fit model. Those two models will give us a very clear understanding of how enzymes work. And those models also, they give us an illustration of how enzymes do work. It is my honor also to invite the podium, the next presenter. Thank you very much for your attention. Wow.
Good afternoon, everyone. My name is Natasha Chobra, second semester student at Science Medical University studying equivalent. So today I'm going to be taking you in the uses of enzymes in medicine. Enzymes are essential in diagnosing diseases by chemical testing, treatment of diseases, and in anesthesia during an operation. I will be taking you specifically under how enzymes work during diagnostic tests. Many enzyme activities are measured to detect disease or monitor treatment progress. For example, liver function tests. These tests measure enzymes like ALT, which is alanine aminotransferase, and AST, which is aspartate aminotransferase, to access liver health. Cardiac enzyme tests like these enzymes tests measure enzymes like troponin and CKMB, which is creatine kinase MB, to diagnose heart attacks. Specific enzyme tests like cardiovascular diseases, troponin indicator for heart muscle injury, particularly for diagnosing heart attacks. Creatine kinase elevates levels in blood to indicate heart muscle injury. Liver diseases, alanine aminotransferase, and aspartate aminotransferase, elevated in conditions like hepatitis and liver sclerosis. GGT and alanine phosphases elevated in biliary obstruction. Enzyme makers in cancer diagnosis. Prostate-specific antigen, PSA, is an enzyme used to monitor prostate cancer. Alkaline phosphatase, ALP, elevated levels can suggest bone, liver, or bladder cancer. Lactase dehydrogenase, LDH, elevates in several cancers, including lipoma, leukemia, and melanoma. Role of enzymes in infectious disease diagnosis. Enzyme-linked amino solvent, assay, which is ELISA. These are enzyme-based tests used to detect antibodies or antigens related to infections. Example, HIV diagnosis using enzyme-labeled antibodies. Enzyme amino acids, EIA, these are used to detect disease, to detect viruses, bacteria, and other pathogens. Enzymes in genetic testing and disease diagnosis. Polymerase chain reaction, PCR, uses DNA polymerase enzyme to amplify DNA, which is useful in diagnosis of genetic diseases and infections. Enzyme-linked gene analysis, identifying gene mutations responsible for conditions like cystic fibrosis or sickle cell anemia. Advantages of enzyme-based diagnostic methods. sensitivity, and specificity. They can detect specific biomarkers that are indicative of certain diseases, non-invasive and fast. Many enzyme-based tests require small blood samples and offer quick results. They have a wide application. Enzyme tests used in a variety of specialties like cardiology, oncology, infectious disease, and more. Limitations of enzyme diagnostic tests. False positives or negatives. The levels of enzymes indicated can be affected by factors unrelated to disease, cost, and availability. Some tests can be expensive or limited in availability in certain regions or countries. Interpretation of results. Elevated enzyme levels might not always indicate a serious condition requiring more investigation. That's the end of my presentation. I will call upon my fellow colleagues.
Good afternoon, ladies and gentlemen. So, I'm sure we are all having a great day. And so far, we have looked at the characteristics of enzymes and what are enzymes specifically. So, as of now, we are going to look at the use of enzymes in the medical field. So, enzymes can be used in treatment. They can be used in treatment in the case of thrombolytic therapy, which is basically associated with blood clots. These blood clots can build up in the muscles. They can build up in the muscles and cause not in the arm muscles, but in the heart muscles. So they can build up in the heart muscles, and that can lead to cardiac infarction, which is basically a heart attack. And also we can find the same blood clots in the brain, which leads to basically a stroke. And now looking at the use of enzymes, the enzymes we incorporate in this aspect is streptokinase, alteplase, and urokinase. So enzymes, looking at this at the thrombolytic therapy, enzymes are actually a key aspect in treating such conditions. Yeah. So moving on again, we can have the use of enzymes in anesthesia, which is basically looking at the operation of being induced with a drug when you are in medical, whether you are removing a tooth or you are having a complicated examination. This lessens the pain, and leads to a safe operation as well. So, as mentioned, it leads to a safe operation, but this leads to a safe operation by relaxing the muscles in the body, by blocking the enzyme known as acetylcholinesterase to achieve this. So we look at another use of enzymes, which is used in analgesia, which is basically just reducing the sensation of pain. Drugs like aspirin, which we use daily, ibuprofen, diclofenac, block enzymes like cyclooxygenase, reducing again the sensation of pain. And then commonly, for meat lovers, there's a disease called gout. So this disease called gout is also treated with enzymes. A drug known allopurinol blocks the enzyme xanthine oxidase, which leads to treating gout. You can set up more in details on how the enzymes are also incorporated. And lastly, but not last before my colleague comes and looks at other measures. Look at the common use of looking at the blood sugar levels. Blood is drawn when you come to the hospital or any clinic or any facility. There's a small device. You will find a small device. There are enzymes in there. It's called the glucometer. So in the glucometer, there are enzymes, glucose oxidase, which measures the blood sugar levels. And so I'm done with my part of the presentation. And once more, my name is Marcel Upindi, first and second semester student. Thank you.
Good afternoon.
Yes, sir. Good afternoon, Catherine. My name is Nasayan Diana. I'm a first year, second semester student at Lusaka Medical University under the Faculty of Medical Sciences. I'll continue on looking at enzymes and diseases that can be cured by using these enzymes. So in other countries, these methods that I'm going to explain, that I'm going to dig more into, are being used more than we are using them in Zambia. Or in Zambia, they are less used or not used. So some enzymes are used in gastrointestinal disorders. So these enzymes, they help in digestion when when the body lacks digestive enzymes. So such of diseases or insufficiencies that we have is pancreatic insufficiency, that is the deficiency of, that is when the body lacks digestive enzymes. Therefore, the person or the body can be subjected to a treatment called pancreatic, which is the combination of three essential enzymes, which is lipase that digest on lipids, proteins that digest on proteins, and amylase that digest on carbohydrates. We have also pancreatic failure, which is pancreatic failure. It is highly common in Zambia, especially among people who drink alcohol, alcoholics. So we also have lactose intolerance. Lactose intolerance is when the body fails to digest the dairies, or the body is lacking an enzyme called lactase, which can break down the lactase, the dairies. Therefore, lactate supplements can be given to such a person. Some enzymes are also used as enzyme replacement therapy. So these are used in genetic disorders with enzyme deficiencies. Such of genetic disorders, we have Gaucher's disease, which is a deficiency of glucocerebrosidase. Therefore, a person can be given an enzyme called migrarosidase. Then we have complex disease, which is the deficiency in alpha glucosidase. Therefore, a person can be given malazone in replacement of alpha glucosidase. We also have a disease called fibrin disease, which is a deficiency in alpha glucosidase A. Therefore, alpha glucosidase can be given in such a person who is lacking. Some enzymes are also used in cancer treatments. So some of these enzymes, they are used to break down cancer cell structures. Example of such enzymes, we have asparaginase, which is used in acute lymphoblastic leukemia. We have collagenase and aromatase, which helps in tumor penetration. So going forward, we have also enzymes that are used in wound healing pains. Instead of us getting cotton and sodium, then putting on the wound on the wound, in other countries that are highly that are use those which use these enzymes, not sodium and the cotton. So they use enzymes such as collagenase, which will break down the damaged collagen. They also use papain and bromelain, which is used in enzymatic distribution. So these enzymes, they assist in removing the dead tissues and promoting healing. Therefore, if someone is having a wound and that person is given, or the regimen that they use is sodium and cotton, we use the treatment is going to take long for the wound to heal. But if we use these enzymes, the wound will heal very fast. We also have enzymes that are used in neurological disorders. So these enzymes, they treat conditions with toxic protein accumulation. An example, we have polymerase inhibitors, where we have example like Dr. which manage others. We have the surface, which is used in Hunter syndrome. We also have enzymes that are used in infectious diseases. So these enzymes they are used to break down bacteria, biofilms, and aid biotics. An example of such enzymes, we have lysosomes, which attack bacterial cells. We have donase alpha, which is abbreviated as DNase, or in our textbook you find it is written as DNase, which is used to which reduces the mucus deposit in cystic fibrosis. I've come to the end of my presentation, or part of my presentation. I would like to call my colleague to finish up with the conclusion and the challenges for further research. Thank you.
Once more, ladies and gentlemen, from the presentations that have been done, and I believe you actually see that enzymes, they are at the pivotal of everything that we do. They are central in the medical field, they are central in the industry, they are central from a health point of view. So it's actually left to us, and we give an appeal as students, say if more attention is given in the research area regarding enzymes. For example, we have got the recently propounded smart drug delivery system in the pharmacology studies, where an enzyme is just put into a drug, administered, and then it targets straight to the affected tissue or affected organ, and therefore improving efficiency and effectiveness in the administration of drugs. That's one example. So the area of enzymes remain very ample, and we can't overemphasize the potentials that are untapped as we put our resources, as we invest our time, as we invest also in resources to researches in enzymes. Ladies and gentlemen, your attention to us was very valuable. We thank you.
Okay, thank you very much to our wonderful presenters for that great presentation. I'm sure they deserve another round of applause. Ms. Shinondo, over to you before you go into question time.
Excellent. Thank you. Excellent presentation, team. Job well done. Now, before we get into it, I would like to do a short roll call. How many of us are listening from our Chalala campuses? You can simply indicate in the chat. Those who are listening from different sites, please feel free to let us know where you're listening from. Whether you're listening from UTH, Levy, or any of our other campuses, please let us know. Okay, we have Sitole, Chalala campus, welcome. We have Cassandra, again, Chalala. We have someone, Yambani. This is ODL, that's open distance learning. That falls under blended learning. This is great to have you. We have a number, we have two more from open distance learning. You're most welcome. We also have a lot more from Chalala campus. This is great. To name a few, we have Beverly, Kanani, Hope, Danny says, nice presentation. We have another one from Open Distance Learning, Benita, you're most welcome. Excellent. Now that we have exercised a bit, it is time for question and answer session. Now, you can either ask your question by writing it in the chat, or you can raise your hand. The floor will be given to you. Once again, please feel free, take advantage of this opportunity. This is your chance to get better acquainted with online sessions, as well as to learn more about the topic at hand.
Okay, thank you very much. Before you go into the question and answer session, let me recognize the presence of Dr. Ikona, the former Dean, Faculty of Radiation Sciences. Thank you very much for joining us, Doc. We can now get your questions. If you have a question, please raise your hand or post it in the chat box. Anyone with a question before we give you a quiz at the end? What's the words of any question before you come to it is either we've heard everything or we have not heard anything at all.
That's a good one.
Our GPC research.
We have a few more comments. Nice presentation, listening from Chalala campus. Another one, amazing presentations. We have a comment saying it's all clear. We have Mukosa giving an applause. Thank you. Well, if we don't have any questions, Dr. Chirwa, I think we can invite, we have a question from Estrage. Estrage? Please correct me if I mispronounce it. What class of enzymes catalyze reactions where there is rearrangement of atoms? Within the same molecule.
Yeah, thank you very much for that question. We are going to have a reaction from one of our participants.
So, isomerase enzymes.
Okay, thank you very much.
We have another one, but I actually see Mukosa, you have your hand up, please. The floor is yours.
Good afternoon.
Good afternoon, Mr. Mukosa. Kindly go ahead with your question.
No, it's not a question, it's just a comment. It has been a very nice presentation, and I just want to thank the presenters, and I liked the diagrams there. How I wish I would have added some questions in those diagrams. I think they are nice diagrams. How I wish they could maybe just to take them back. There were those diagrams and arrows there. I would have applied my differential equations nicely. No, keep it up, the presenter. We really like your presentation. Thank you.
Okay, thank you very much for that information.
Wonderful, thank you. We have another comment from Beverly. How does ethanol work as a competitive inhibitor in the treatment of ethylene glycol poisoning?
Can you go through the question again?
How does ethanol work as a competitive inhibitor in the treatment of ethyl glycol poisoning?
Anyone to react to that? From Martino Presentantion. Come again.
I think we need to assist.
Okay, Mr. Rico.
Yes. Okay, so though my presenters didn't mention that because we didn't want to overload the slides with information. Yeah, so ethylene glycol is an alcohol, and ethanol is also an alcohol. So both are alcohols. So they will similarly try to bind to an enzyme called acetaldehyde. So whichever is in more quantity, if a person has consumed the poison ethylene glycol, that toxicity can be reversed by putting a much more stable alcohol, which will not result into production of very toxic products like formaldehyde and so on and so forth. So by giving them as ethanol, then we are making the ethylene glycol to compete for binding to acetaldehyde.
Okay, thank you very much. And I'm sure ethanol and ethylene glycol got the same structure for them to be able to bind to the same active site. So that's an example of competitive inhibition. Okay, thank you. I think we have another question from Beverly. Oh, that was the one.
However, we do have another one from Wonder Kid. The question is, what is enzyme immobilization and how does it enhance the efficiency of enzymes in medical applications, or rather in medicinal applications?
Enzyme immobilization is a process of confining enzyme either to a solid support or while it remains or while it still retains its catalytic properties. And there are methods of doing so by absorption and by covalent bonding, and the other one by enshapment.
Okay, thank you very much. Do we have any question before I give them a quiz? We seem to be running out of time.
Currently, we don't have any questions, so you may begin.
Okay, thank you very much. Okay, question one. This is a giveaway question. What is an enzyme? Option A, any compound that will speed up the rate of chemical reaction. B, a compound up the rate of a chemical reaction. A biological inhibitor, a biological molecule that will slow down rate of reaction. Daniel Sony says A. A majority of people are saying B, which is correct. A is not correct. For example, if I were to heat up anything, if I heat up a chemical reaction, definitely that will speed up the rate of reaction, but that heat is definitely not an enzyme. So an enzyme has to be within a living cell. So majority of people have gotten that correct, B. Then enzymes are protein in nature. That's the other factor. We come to question 2. How do enzymes speed up the rate of reaction? By putting the substrate forward at a fast speed, by giving energy needed by substrate to react, by lowering activation energy of the reaction, none of the above. Our presenters, that is the correct answer. Correct. Lowering activation energy. Who can define activation energy for me again? Correct. Minimum amount of energy required for a chemical reaction to start up. Okay, correct. Question 3. In which of the following aspects of medical practice are enzymes important? Diagnosis, treatment in the operating theater as muscle relaxants, then all of the above. We come to question 3. Wonder Kid says D. Sumusa has gone for D. We are all picking D. Is D correct?
Yes.
Okay, very much correct. A resounding yes from our presenters. We come to our next question. In determining blood glucose levels, what enzyme is the main player and it is incorporated on the glucose stick? Glucose oxidase, glucose fructokinase, glucose cyclooxygenase, glucose levels cannot be measured. Question 4, what is the correct answer? It should be C from the presentation. Yes. It's A. Stay. Glucose oxidase. Okay, our listeners have gotten that one wrong. What is the correct answer? Even the presenters are divided. Is it the Okay, thank you. Question 5. Or question 4. In determining the blood glucose levels, what enzyme is the main player and it is the, oh, we've done that already. We come to question 5. Non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, and diclofenac reduce sensation feeling by decreasing synthesis of prostaglandins. What enzymes do non-steroidal anti-inflammatory drugs block? Question 5. What is the answer to question 5? Sensation of pain. Reduce sensation of pain. Okay, non-steroidal drugs like aspirin, ibuprofen, diclofenac reduce sensation of feeling pain by decreasing synthesis of prostaglandins. What enzyme do non-steroidal anti-inflammatory drugs block? Okay, we have someone has gone for alanine amide transferase, another one is saying cyclooxygenase. Option A, we have xanthine oxidase, then troponin is D. Which is the correct answer? C. Okay, thank you very much. C is correct. Which enzyme is the marker for heart muscle injury? Troponin, aspartate aminotransferase, allopurin, no, such an enzyme does not exist. Which enzyme is the marker for heart muscle injury? Troponin, aspartate aminotransferase, allopurin, no, then option D, such an answer does not exist. At the moment, we have C and A. Let me get one more reaction from our audience. Representatives, what is the correct option? Oh. A or C? A. Okay. A is the correct option. Thank you very much. So that marks the end of our quiz. So enzymes are part of year 1 semester 1 curriculum and year 1 semester 2 curriculum. Once again, whatever we learn comes from the curriculum. These questions are going to show up either in the 3A or in the final examination. Shall we please take our presentation as part of teaching and learning? Ms. Shinondo, over to you. Question 6, majority of the people, all the people have gotten it correct. A.
Excellent. Well done. Well done to everyone. Dr. Chua, this is a great initiative, and I'm sure most of our attendees will not forget this. I would now like to invite comments and questions from our professorial team. I would like to acknowledge the presence of our Deputy Vice Chancellor, Professor Tuckson Lambert. I understand he's in the room with our presenters. Welcome, Professor.
Thank you very much, and I must first of all thank Premed. The level you have taken, this is the way it should be. Because your students are already thinking what we are learning now, the knowledge we are acquiring will make us excellent health workers, excellent doctors. All I'm requesting is don't lose these notes. You will find it useful even at your postgraduate level after your MPC. You still find it very. This is the kind of knowledge we want to encourage our students in Lusaka Apex Medical University to acquire. But don't lose your notes. These days you have gadgets which can help you save and store this knowledge. You will need it 20 years from now. In the research field, you will need this kind of information. Apex is preparing for you ahead of time. We have big research centers in Lupumsa. And before you graduate, the dean will take, he has been there several times. That's where we should build as an institution. And this is the kind of information we need. You'll be most cost-effective health workers. For example, I'll give you one example. You will meet patients in the future, acute abdomen. Patient comes to you with acute abdominal pain. Abdomen is distended. You touch the tenderness everywhere with the card. You take your stethoscope and listen to the bowel sound. They will be absent. A lot of misdiagnosis. A lot of people will say intestinal obstruction. After all, patient abdomen is distended and is vomiting and is tender all over, is intestinal obstruction. They take this patient to theater, big laboratory, called exploratory laboratory. Low incision, be it paramedian or median incision. They open there. They find the circulation, the amylase enzyme has been released, is digesting all the tissues there. Then they realize what is the problem? Pancreatitis. Then why did we open? Long incision. It's pancreatitis. Releasing amylase enzyme. You understand? Now for you clever one to say, before we operate, can we do urgent serum test of amylase? And it will come out highly elevated. You have prevented a long incision on the patient. After long incision, how the hospital stay? Maybe 10 days. Look at the cost of stay, of just misdiagnosis. A simple test of serum amylase, which you have didn't even put there. acute abdomen. So you maintain these notes. You be effective health workers, cost-effective health workers. Maintain these notes. When you be practicing, you remember that let's do an emergency test of serum amylase, the enzyme. So I'm just saying to you, keep these notes, you will use them 10, 20 years from now. You will meet patients like this. The cardiac trauma, any chest injury. You want to check if the myocardium has been affected, the heart muscle. You will do that test. You'll be comfortable. You have done the diagnosis and do the right treatment. So all I'm begging you, please don't lose these notes. And for lecturers, we reserve this. We keep in our store. Madam Sinondo and Mr. Zulu store this knowledge. With their permission, I hope we are given. Yes, we are going to repeat this presentation. That's why after this meeting, we go for group photo so that we keep records. You will be repeating this. This was a wonderful presentation, one of the best. But pre-med, that's their standard. So thank you very much, Dr. Chiwa. That was the moderator.
Very much, Mr. Piri and your entire department, chemistry department. So the next presentation is going to be on physics 2 weeks from now. Next week on Monday, we are going to have a guest lecturer from UK, a pharmacist. So Dr. Nyambia, thanks for that time. So for students who are interested in being part of the presentation in physics, kindly contact Madam George, the HOD. Madam Shilondo, over to you. We are done. Thank you very much.
Excellent. Thank you so much. Once again, job well done, presenters. This was an excellent presentation. It showed you really put in effort. And as always, thank you, Professor Lambert, for sharing the infinite wisdom. Now, as he said, please, at the end of this presentation, please make your way outside to the front of the building so that we may capture and make history. With that, we have come to the end of today's virtual pre-medical presentation. I'm your host, Ms. Shinondo, and enjoy the rest of your day. Thank you.